Hello everyone. So most of the gross features of the tongue we have discussed in the previous class. So today we will discuss the lymphatic drainage of the tongue and the nerve supply to the tongue. So before discussing the lymphatic drainage of the tongue, we will quickly revise the parts of the dorsum of the tongue. That is what oral part or anterior two-third part of the tongue, posterior one-third or pharyngeal part of the tongue, and the posterior most part of the tongue, which is attached to the epiglottis. So this is what sulcus terminalis. In front we can see here circumvallate papillae. Posteriorly we can see the aggregation of lymphoid, which is called as lingual tonsil. There are two folds, palatoglossal fold and palatopharyngeal fold. This is what tonsillar fossa, where the palatine tonsil is located. So now we'll see the lymphatic drainage of the tongue. Before speaking about the lymphatic drainage of the tongue, we should understand that ultimately the lymph from the tongue will drain into deep cervical lymph nodes. Deep cervical lymph nodes. So I have made a schematic diagram to see the deep cervical lymph nodes. So this is the tongue, this is the hyoid bone, this is the internal jugular vein, which is draining into the brachiocephalic vein, and to the hyoid bone this muscle is posterior belly of digastric and this muscle is superior belly of homohyoid. So the deep cervical group of lymph nodes are located along this internal jugular vein. So this lymph node that is located, this group of lymph node that is located below the posterior belly of digastric, this is called a jugulo-digastric group of lymph node. And above the superior belly of homohyoid along the internal jugular vein, this is jugulo-homohyoid group of lymph node. So these are what deep cervical group of lymph nodes. And one more below, this is submental group of lymph node, this is submandibular group of lymph node. And now we'll see the dorsum of the tongue. The dorsum of the tongue, we are divided, as we know, this is anterior two-third part, this is posterior one-third part, and this is posterior most part. In along the anterior two-third part, this group of lymph node is submental group of lymph node. This is submandibular group of lymph node. This I have drawn the schematic version of jugulo-digastric and jugulo-homohyoid group of deep cervical lymph nodes. So we'll divide the anterior two-third part of the tongue into tip, median or central part, and lateral part. Okay. Now we'll see how the anterior two-third part of the tongue limbs get drained. So the tip will drain bilaterally into submental group of lymph nodes. Now the lateral part will drain into submandibular group of lymph nodes. And now the central part, some part of the central part will drain into the ipsilateral group of jugulo-digastric lymph node, and some part will drain into the contralateral part of the jugulo-digastric group of lymph node. And in this way, here also we'll draw, this is the tip part, and this is the lateral part, and this is the central part. So the tip part will drain into submental, lateral part into submandibular, and the central part will drain into jugulo-digastric group of lymph node. So we'll see now, we'll write here. So the tip part will drain into submental group of lymph node, lateral margin into submandibular group of lymph nodes, central part will drain bilaterally into jugulo-digastric group of lymph node. Okay, and ultimately this submental group of lymph node will drain into submandibular group of lymph node, and this submandibular group of lymph node will drain into jugulo-homohyoid group of lymph node. And similarly, the central part that was draining into jugulo-digastric, that will also drain into jugulo-homohyoid group of lymph node. Okay. Now the posterior most or the pharyngeal part of the tongue, it will will drain into jugulo-homohyoid group of lymph node directly, and some will drain bilaterally to the contralateral side of the jugulo-digastric group of lymph node. And so in this diagram we'll see, so some part of the posterior most part will drain into jugulo-digastric group of lymph node, and some will drain directly into the jugulo-homohyoid group of lymph node. So in this way we can conclude that the submental, so for example the tip of the tongue submental, then to the submandibular, then into the jugulo-homohyoid group of lymph node. Similarly, the part which is draining to the jugulo-digastric will ultimately drain into the jugulo-homohyoid group of lymph node. So in this way we can say that jugulo-homohyoid lymph node, it is the principal lymph node of the tongue. So we should remember that the lymphatic drainage of the tongue, the principal lymph node of the lymphatic drainage of the tongue is jugulo-homohyoid lymph node. So we'll complete this. The posterior 1/3 and posterior most will drain. Some part will drain into jugulo-digastric and some will drain into jugulo-homohyoid. The part that is draining to jugulo-digastric will ultimately drain into jugulo-homohyoid group of lymph nodes. So in this way we have completed the lymphatic drainage of the tongue. So now we'll see the nerve supply or the nerve innervation of the tongue. So innervation we can divide into two parts: the motor supply of the tongue and the sensory supply to the tongue. Motor supply to the tongue, all the muscles of the tongue are supplied by hypoglossal nerve, except Palatoglossus muscle. This is supplied by pharyngeal plexus. Now the sensory innervation to the tongue will divide into two parts: general sensation and special sensation. That is what? Taste sensation. So we'll divide this into three parts: anterior 2/3, posterior 1/3 and posterior most part. So general sensation to the anterior 2/3 part of the tongue is supplied by lingual nerve, which is what? Branch of mandibular nerve, which is branch of trigeminal nerve. Special sensation to the anterior 2/3 of the tongue is by chorda tympani nerve, which is branch of facial nerve. Now the posterior most part of the tongue, both the general and special sensation are carried by glossopharyngeal nerve. Similarly, the posterior most part of the tongue, it is supplied by internal laryngeal nerve, which is a branch of vagus nerve. So in this way we can remember, so we can write like this: anterior 2/3 5 7, posterior 1/3 9 9, and posterior most 10 10. So this is the nerve supply of the tongue. So the motor supply of the tongue is by hypoglossal nerve, except palatoglossus, which is supplied by the pharyngeal plexus, and the general sensation, the sensory supply, general and special. General 5, special 7. 5 is lingual and chorda tympani, and special by the posterior 1/3 of the tongue by the glossopharyngeal nerve, and posterior most by the internal laryngeal nerve, that is vagus nerve. So in this way we have completed the lymphatic drainage and the nerve supply to the tongue. So in the next video we will discuss the development part of the